Welcome to another Medical Director Minute. My name is Dr. Brian Everett, and today we're going to do an update on monkeypox. Monkeypox is an orthopox virus similar to smallpox. It can be self-limiting, however, the young tend to be more affected. There are two subtypes, West African and Central African. Central African tends to be more deadly, with the mortality high as 11%. It was first ID'd in primates and was first noted in humans in the 1970s. Because of the eradication of smallpox, it has become the dominant orthopox virus seen today. This is an updated map of all the affected cases in the United States as of the recording of this video. There are 12 reported cases in Texas, however, none are reported in San Antonio at this time. How is the virus transmitted? Well, there's several different ways. First, you can have direct contact with bodily fluids, direct contact with skin lesions. It can even be passed through respiratory droplets, or you can touch something that has been contaminated. We will talk soon about ways we can protect ourselves, but we need to remember that contaminated objects can still contain the virus, and we need to pay particular attention to that. What are the signs and symptoms? About 5 to 21 days after the initial infection, the patient can have flu-like symptoms. This includes headache, myalgias, fatigue, and fevers. What differentiates the patient from other types of viral infections is the lymphadenopathy that develops. Then about 1 to 3 days later, the patient will develop a rash. This rash will typically start on the head and spread downward. It will also include the palms and soles. The rash will be evolving, starting as flat macules, then develop into papules, then fill with clear fluid known as vesicles. Later, pustules will form, and these pustules will crust over. This can last up to 3 weeks. What should we do for patients we suspect are actually having an infection secondary to monkeypox? Symptomatic care at this time. Treat fevers, give fluids, look for evidence of co-bacterial infections, and treat for sepsis if needed. We need to continue to take viral precautions, especially when dealing with these patients. Continue to wear your mask, wear eye protection, and gloves. Be sure to pay particular attention to dwell times to antiviral disinfectants, so that we allow enough time to kill the virus. Thank you for listening to this Medical Director Minute. Please like, share, and subscribe. Continue to do great work out there in the field, and come back to learn more about ways we can enhance patient care.